بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. I will talk about the deviated nasal septum and nasal foreign body. The nasal septum consists of two parts, the anterior cartilaginous, which is formed by the quadrilateral cartilage, and the posterior bony part, which consists of the perpendicular plate of ethmoid and vomer. Septal deviation. This may result from trauma, either during descent down in the Peart canal or from direct nasal trauma in later life. It is also believed that the differential rate of growth, the difference in the growth rate between the nasal septum and the rest of the midface, may lead to a buckling of the septum in some cases. Types of deviated nasal septum. We have the anterior dislocation of the septum, which is called Cordell dislocation, the C-shaped deformity of the septum, and the S-shaped deformity, and the septal spurs, which is an angulated deviation or shelf-like projection of the septum, and the septal thickening. This is the caudal dislocation of the septum, and this is the angulated deviation or septal spurs. You see, septal deviation can cause nasal obstruction, and the touching mucosa or kissing mucosa of the septum with that of the lateral nasal wall can cause facial pain and headache, and this is called anterior ethmoidal syndrome or Slater's neuralgia. And the septal deviation can cause obstruction of the middle meatus with impairment of the ventilation, aeration, and drainage of the sinuses, and this will cause sinusitis. What are the clinical features of deviated nasal septum? The most common symptoms are nasal obstruction, either unilateral or bilateral nasal obstruction, headache and facial pain due to touching mucosa, sinusitis due to obstruction of the middle meatus, epistaxis because deviation of the septum can cause dryness of the nasal mucosa with formation of the crust, and the removal of these crusts can cause epistaxis. External deformity, where the septum goes so the nose goes. Middle ear infection due to dysfunction of the Eustachian tube, and the patient can present with anosmia or hypoosmia. This is a coronal CT scan, shows a C-shaped deformity of the septum with nasal obstruction and compensatory hypertrophy of the turbinate on the opposite side. This is another coronal CT scan, shows the bone spur with the touching mucosa, which can cause facial pain and headache, and obstruction of the middle meatus. The treatment of septal deviation is by septal surgery, which is called septoplasty. In septoplasty, we do incision at the caudal end of the septum, anterior part of the quadrilateral cartilage, and this is called Freier's incision. And then we elevate the mucopericondylar flap on one side with the excision and stripping of the lower part of the quadrilateral cartilage, few millimeters, 3 to 5 millimeters along the floor of the quadrilateral cartilage is removed. And then we do posterior chondrotomy. We separate the posterior part of the quadrilateral cartilage from the perpendicular plate of the ethmoid with the excision of any angulated part, any bony spur which can cause airway obstruction. We remove the deviated part, and then we do closure of the incision with bilateral nasal supplement on both sides to immobilize the septum with bilateral anterior nasal packing. Nasal foreign bodies, it is common between 2 and 5 years. They may be inert, hygrophilic, or corrosive. Signs and symptoms of foreign body in the nose. Most common presentation are unilateral foul-smelling nasal discharge and unilateral vestibulitis. Any child who presented to you with unilateral foul-smelling nasal discharge, you should exclude foreign body in the nose. Other clinical presentation are unilateral nasal obstruction and epistaxis. Management. An otoscope can easily be used to examine a child's nose. Ask the child to blow their nose if they are able. Solid foreign bodies such as beads are best removed by passing a wax hook or Jobson horn probe beyond distal to the foreign body and gently pulling it forward. Avoid grasping the object with a pair of forceps, since this may simply push the foreign body further back into the nose or airway. Soft foreign bodies may be grasped and removed with a crocodile or tele forceps. Prefer to remove foreign body under GA. If failed removal of foreign body in the posterior part of the nasal cavity, if the foreign body in the posterior part, in the distal part of the nasal cavity, the removal should be done under GA. And if the child is uncooperative, also the removal of foreign body should be done under GA. Good luck.